All right, everyone, welcome. It is noon, so we're going to go ahead and get started. Thank you to everyone for joining us today for our Spring into Health event. My name is Haven Spanier, and I'm the Senior Director of Programming at the University of South Carolina's Alumni Association. It's my pleasure to get to introduce our hosts of today's event, but before we do, I have a few reminders for you all. First off, I'd like to thank Prisma Health for making today. I also want to encourage you all to ask all of your questions throughout today's event, which you can do in the chat or into the Q&A, whichever one's easiest for you. If you aren't super familiar with Zoom, there should be a panel across the bottom of your screen with a chat button and a Q&A button, and we will get to as many of those questions today as we can. But without further ado, I'd like to introduce our hosts. First, Dr. Berson received her medical degree from St. George's certified by the American Board of Psychiatry and Neurology in Psychiatry and Child and Adolescent Psychiatry. And Dr. Briggs received his Doctorate of Nursing Practice from Yale School of Nursing at Yale University. Dr. Briggs is originally from South Carolina and is board certified in Psychiatric and Mental Health NP by the American Nurses Credentialing Center. So thank you both for joining us today. We're really looking forward to hearing from you.
All right, I just unmuted. Thank you so much for having us today. I'm not going to speak for Dr. Briggs, but I'm excited to be here. Dr. Briggs, I think you are too.
As am I.
Okay.
Yep.
Okay.
Although I am a Clemson grad, I am always excited and delighted to serve my Gamecocks.
This is one of my favorite topics to talk about. So thank you so much for having us today to talk about just media in general and how that applies or what we can see with what that means for mental health. And thank you, Hayden, for that wonderful introduction. I really appreciate it. Sorry about this. I'm gonna advance the next slide here. So the first thing is that neither Dr. Briggs or myself have any disclosures at this time, but that should influence anyway in this discussion or topic. I think it's just something we're both passionate about and enjoy talking about. So why do we even care about media and mental health and kind of what that means? Well, I'm a child and adolescent psychiatrist, and so for me, this is a big part of what I'm seeing and a big part of what we practice. So just to give some ideas, in the 1970s, children began to regularly watch TV at 4 years of age. But by 2012, the average child was 4 months when they started to first watch a TV. So there's this shift in trend toward younger and younger kids getting involved in kind of witnessing and seeing media. In 2015, Common Sense Media, which we'll talk about at the end a little bit more, had reported that on average, teens engage in 9 hours of entertainment screen media a day. 9 hours, that's about what we want kids to be sleeping a day. So 22% though reported almost constant internet use. So they're really spending a lot of their time on different platforms. And then more than 90% of teenagers with mental illness will seek help online due to the perceived accessibility and anonymity. So it's really, really important to what I do in a practice and has a huge influence in terms of what teenagers and kids with mental health are getting involved in. Now, I'm going to pass this over to Dr. Briggs for a second, too, to talk a little bit about what this presentation, though, what we're not going to cover and why that's interesting and important, too.
All right, so we'll talk about, and again, thank you all so much for having me. I am delighted to be here and just excited about the opportunity to talk about media and mental health. And we thought it was important to sort of talk about what we would not discuss in this presentation as it relates to media and mental health. And so we're going to talk about the Goldwater Rule. And I think that's important for us to understand as it sets the floor for us in this presentation. And so the Goldwater Rule essentially is the rule that was put into place that puts certain restraints on psychiatrists or psychiatric providers when it comes to making comments about political candidates or even people in the media in general. And this was derived from Barry Goldwater's presidential bid in 1964. And interestingly, Facts Magazine did a survey of approximately 12,356 psychiatrists by asking them the following question related to Goldwater's mental health. And they asked those psychiatrists that they surveyed, do they believe that Barry Goldwater is psychologically fit to serve as president of the United States? And as you can imagine, within those 12,356 participants, that the responses varied widely. But one of the most notable ones that I saw, that they essentially called him a megalomaniac, and said that he was very grandiose and impotent in his ability to effectively communicate and to connect with people emotionally. And so the APA at that time thought, in order for us to make sure that we don't diminish the value of our profession or even further ostracize or weigh in on a person's mental health without having a personal connection, that they established the Goldwater Rule of 1973. And in response to the survey, the then director of the APA stated this. He said, should you decide to publish the results of a purported survey of psychiatrists' opinion on the question that you have posed, then the association will take all possible measures to disavow its validity. And so they didn't want to give any sort of credence to surveys about individuals' mental health. And so what we don't want to do today is, although we'll talk about the various forms of media, we will not get into specific diagnostic criteria and talk about an individual's mental health from the perspective of clinicians. We will present stories and anecdotes and information that we hope that would be helpful. But again, we're not doing this under the guise of clinical assessment or diagnostic assessments for these individuals. You're muted, Casey. You're muted.
Thank you so much. Yeah, so I'd also like to take a step back and talk a little bit too about the influence of media as well. Just because we keep hearing about fake news and what's real and what's not. So what we find when we look into it is that in many cases, the media has limited control over what people think about a product, right? So they're not going to be able to influence whether someone finds it likable, unlikable, attractive, or unattractive. But they are really good at setting the agenda of what we're thinking about. So for example, if we think about that whole McDonald's lawsuit, and the legal case that ensued in terms of someone burning themselves, right, with the drink. Some people will hear that and hear about the lawsuit and just think that they want a cheeseburger, right? So even though that has no bearing or no content on what they're talking about, right, it still plays a role in kind of influencing that we're thinking about McDonald's. Adolescents in and of themselves are uniquely susceptible, to social media influence. So we'll get into that. So the developmental tasks for adolescents has really remained unchanged throughout the years. They're still working on identity versus consolidation. We're navigating intimacy and sexuality. There's no clear link between online activity and your self-concept, but adolescents do use social media to explore those ideas and experiment with who they are. What we find, and there's this quote that we always talk about, and that the richer get richer when we're talking about social media. What that means is that adolescents that already have well-developed social skills are able to capitalize effectively with social media and do really well there. They make a lot of gains. But teenagers that don't and that have poor social skills fail to make those same gains. And those that are using Facebook to compensate for the poor social skills, they demonstrated an increase in loneliness over a 5-month period. The other thing that happens in adolescence is our frontal lobe is still developing, and that'll continue to happen till your mid-20s. So risky behavior kind of goes hand in hand. It's normal for adolescents to make mistakes and try things that are a little bit dangerous. Risky social media posts, though, carry consequences and implications for behaviors that last for a lifetime, because nothing really goes away once it's online. So what's normal behavior can have those long-lasting consequences and impacts, and that's something that we need to think about when we're talking about the use for teenagers. What I find really interesting, and I pulled it up earlier, is this Sean Parker interview. So I'm going to play part of it, and hopefully it'll work. If you can't see it, Asa, or hear it, please let me know. But we'll go ahead.
As he's not sure how much Facebook is benefiting society. Parker was the founding president of Facebook when the company started over a decade ago. He recently made some very jarring comments about social media exploiting the vulnerabilities in human psychology during a conversation with Axios. Here's what he had to say.
You know, if the thought process that went into building these applications, Facebook being the first of them to really understand it, that thought process was all about how do we consume as much of your time and conscious attention as possible. And that means that we need to sort of give you a little dopamine hit every once in a while because someone liked or commented on a photo or a post or whatever. And that's going to get you to contribute more content, and that's going to get you, you know, more likes and comments. I mean, it's a social validation feedback loop that it's like it's exactly the kind of thing that a hacker like myself would come up with, because you're exploiting a vulnerability in human psychology. And I think that the inventors, creators, you know, and it's me, it's Mark, it's the, you know, Kevin Systrom at Instagram, it's all of these people, understood this consciously, and we did it anyway.
So I think as we're kind of getting on and thinking, it's really important to think about that and to know, right? If you're not paying for something, if you're online and you're using social media, you are the product, right? There is something that they're gaining, and they want you to spend more time there for a reason. But it's not all bad, right? So there's absolutely good things about media, about social media specifically, and some groups do benefit. Social media really, really allows also specifically for marginalized youth to form connections. Youth with mental illness have reported greater social connectedness and feeling of belonging with social media use. They can share personal stories and coping skills. They can avoid that stigma and judgment and gain kind of just information that they wouldn't maybe get in other areas or circumstances. The risks that we talk about, one is kind of what are we doing online? There's a lot of misinformation, negative communications, right? How do we know who we're even talking to? Unhealthy influences. And then there can be delays then in seeking out traditional resources and traditional help. What's interesting too is that they found that passive consumption of social media, so that's just scrolling through and looking without kind of engaging, that's the piece that's actually been linked with increased feelings of loneliness. Whereas two-way communication, if we're using FaceTime and talking, if we're texting our friends, if we're engaging, that's actually, that has not been found to have the same association, which is helpful and good to know, especially in times of COVID.
All right. And so, yep. So then what I'll do is I'll talk about mental health, social media, advocacy, and education. And so as Casey mentioned, or Dr. Berson mentioned earlier, just this idea of passive participants in social media and misinformation. And so one of the things that the internet has provided is what we call the information superhighway, right? And so in terms of access to individual content, articles, and the like, the internet has provided a means by which individuals can access loads and tons of information. And why is this important for us as healthcare providers, in particular mental health providers, is this Pew Internet Group, and they conducted this study in 2009, and they found that 61% of adults stated that they look online for their healthcare information. And so these e-patients, are, as they are called, are reviewing the experiences of other individuals who have similar health-related issues, often leading them to making healthcare decisions based on information not necessarily produced by medical research. As I think about mental health services in particular, we call these patients e-patients or WebMD providers. And so they scour the internet looking for signs and symptoms. If they have something that might be remotely close to the nomenclature, then they're self-diagnosing. And subsequently, what they're doing is they're making healthcare decisions based on information that isn't well vetted or peer reviewed. And so what we see is individuals who are waiting for longer periods of time to come into the clinic to get assessment for diagnoses and subsequent treatment, is that they're doing things on their own, or they're doing things that are based on internet research only. And so what I found that is, if healthcare providers use the tool of blogging or using social media as a tool of engaging with individuals whom they may never see in their clinical practice, that this tool could be very advantageous for us in that we could provide health advocacy. And this, I think, is really important for individuals who feel the stigma and the weight of mental illness that often ensues with the diagnosis, as well as educating, right? And so providing them with information that has been vetted and that has been researched, and then subsequently putting them in positions where they can get evidence-based care and evidence-based practice. And so I think that the onus and responsibility for the provider is to do advocacy, education, but then also do it in a manner that is professional. Some of the websites and even some of the blogs that I've visited as of late may actually put patient information that paints a clinical picture where, if that patient were to see that information online, they may say, this provider may actually be talking about me. Or even some folks have taken it to the point where they've actually even put pictures on the internet of the patients. And so while I think the internet is a great tool for advocacy, education, and in particular helping to destigmatize mental health care, we want to do it professionally in a way that does not further ostracize our patients. And so one of the golden rules for me is if I don't do it in my office, then I'm not going to do it on the internet. I want to make sure that my clinical practice is not just relegated to the office in which I sit, but it sprawls out through every practice environment or every sphere that I put information out. And so the internet is no different. And as Dr. Berson mentioned earlier, is that when you put something online, think that it's going to be there for forever. So just don't even think that you can take it back, or you can go back and say, you know what, I don't want this to be here anymore. It's in public record. And then that information, both indirectly or directly, could be disseminated. And then that further sort of puts information out on the internet that is not appropriate, and that may be misinformation as well.
I remembered to unmute myself this time. So yeah, just kind of taking on that and the misinformation that's there, and why that is so important, is there's actually a significant body of research that links internet and social media use with risk-taking behavior, specifically among adolescents. And there are, as Dr. Briggs had let you know, there's online communities that really glorify and normalize and encourage behaviors such as non-suicidal self-injury, suicide, disordered eating, and substance use. So those aren't hard to find. This is a picture kind of alluding to the Blue Whale Challenge, which I'm not sure if you've heard about, but this allegedly had led to the deaths of dozens of youth in Russia and around the world. And it was a way to kind of pull kids in. It was 50 days of escalating tasks that culminated in suicide. But many experts actually believe it was just originally a sensationalized hoax, and that it's thought, though, that it had led to imitative self-harming and copycat groups. But that being said, the original creator has been jailed. So there are kind of real life harms and real life consequences that have happened as well. What's available online is important. So studies analyzing web content using keyword searches related to suicide found that approximately half of websites were either neutral or pro-suicide in tone. Similarly, in 2008, a content analysis found an equal number of suicide prevention websites as pro-suicide websites, but the pro-suicide websites were visited more often. So that's kind of social media in a little bit. What we wanted to do was just talk about other forms of media as well, and the portrayal of specifically risk-taking behavior and suicide behavior. So the first one that I don't think people think about a lot is Broadway and plays and kind of acting in traditional theater. So Dear Evan Hansen was a Broadway musical. It was nominated for 9 Tony Awards in 2017, winning 6, including Best Musical, Best Score, Best Actor, and Best Featured Actress. I'm going to play a little clip. What I think this musical does well is integrate that idea of social media, the presence of it, and in life for an everyday adolescent. So I would love for you to pay attention specifically to those aspects and how that's portrayed in the background of the next scene. And the next scene is a clip that's taken from Broadway.com. I want to make sure I'm giving appropriate resources and references. So the whole production takes place on that kind of screen where you have the screens, many ones in the background displaying different kind of contents and text messages that are coming through, and kind of that ever-present inundation of media. So after this show came out, the actors received thousands of emails, letters, and tweets from fans. People have stopped them on the street to just share personal stories and to ask advice, especially of those actors who play kind of mothers in this show, because it directly addresses mental health. And I really think that it really speaks toward the power of media and kind of getting a message across and opening up conversation. It's really one of the benefits. The producer, Stacey Midrick, has been quoted as saying, though, in the early marketing meetings, they stayed away from words like suicide and mental health because they didn't want to be known as the suicide musical. However, once they saw just how the show was affecting people, they realized that some things were more important than marketing and messages and talking points, and they embraced that unique ability to impact mental health stigmas. They have ongoing partnerships with organizations that offer mental health resources for kids, young adults, and families, and they've really done a lot to raise money and awareness. So we're going to go toward another example in TV that I think is probably one of the most talked about in recent years, which was 13 Reasons Why, which I think tried to embrace that idea of being mental health, but did it in a different way. So 13 Reasons Why was a show released on Netflix in 2017. It's based on a 2007 novel by Jay Asher. It was one of the most watched shows in 2017 with more than 11 million tweets within 3 weeks of its release. The plot, for those of you that haven't seen or heard about it, is it's a revenge suicide with the watcher learning who is to blame for the death of the protagonist as they go through. There was not much to encourage help-seeking behavior, and adults and professionals were unavailable, disinterested, or ineffective throughout the show. It was loudly criticized by suicide prevention experts, and there was a concern that there would be what we call a suicide contagion effect. So people would see the show and then want to act on what they've seen, or there would be an increase. So JAMA did a study that showed there was an immediate increase in suicides beyond the generally increasing trend among the target audience of the show of 10 to 19-year-old individuals 3 months after the show's release. Now, correlation is not causation, so I'm going to say that right now. These are just interesting findings that we have. And it's the same time that there was an increase in social media interest in the show. 2 months after the study, there was a noted increased rate of suicides. 2 months after they found that, Netflix did remove one of the graphic scenes that depicted in detail the suicide concern. So while there are media recommendations also for responsible reporting of suicides in the news, one of the things that did come out of the show, one of the positives, is content and kind of recommendations for entertainment, the entertainment industry. So national recommendations for depicting suicide with a focus on the entertainment industry were released by the National Action Alliance for Suicide Prevention. They are to convey that suicide is complex and often caused by a range of factors rather than a single event, to show that help is available, portray characters with suicidal thoughts who do not go on to complete the act, connect viewers to resources, portray everyday characters who can be a lifeline, avoid showing or describing the details about the suicide method, and depict the grieving and healing process of people who lose someone to suicide. Consult with suicide prevention messaging experts and people with personal experience, and then use non-judgmental language. So that was kind of the response to what we saw with 13 Reasons Why. Another form of media that did this well was the song. So Logic is a music artist that released a song 1-800-273-8255. So those who don't know, that is the National Suicide Prevention phone line. That's the number. It peaked at number 3 on the US Billboard Hot 100. It was released in April 18th, 2017. It received nominations for Song of the Year, Best Music Video at the 60th Annual Grammy Awards. And according to Wikipedia, which I know is an interesting resource, but it's there. But the National Suicide Prevention Line noted that the calls rose by 27% and visits to their website increased by 100,000 over the following months. Now, the night after the 2017 Music Video Awards, when this song was there, the National Suicide Prevention Line actually experienced a 50% surge in calls to their hotline as well. So I do think this is another just great example of how media can really influence and change who people are going to call, reaching out for help and doing their best to kind of provide those resources. I do have a link to show the video, but as it's about 12:30, we have a couple more slides. I'm not going to show it right now. I'm going to pass it over to Dr. Briggs.
Thank you so much. I was really looking forward to that video, but maybe we can spend some time at the end. But we're going to switch topics to video games. And I know that a lot of negative press, or video games have gotten a lot of negative press in terms of mental health. And maybe even individuals have thought that video gaming increases violence, encourages social isolation, and things of that nature. And I'm going to focus on the benefits of video gaming, and especially in the adolescent population. And so a research study by NPD 2011 indicated that 91% of children ages 2 to 17 play some sort of video game. And then Lanahart 2008 did a representative study of teenagers in the United States. And they found that 99% of boys, surprise, and 94% of girls play video games. And so out of that, they have highlighted four benefits: cognitive, motivational, and emotional. And so what they found from a cognitive perspective is that video games actually enhance cognitive skills. And what was interesting about this particular study was that they found this to be true in shooter games that have traditionally been thought of as violent, and that kids need to kind of steer away from that. But they had a randomized group of individuals who had been naive to shooter games, and those individuals who had participated in shooter games. And so the individuals who were naive to shooter games actually were randomized to play shooter games. And what they found was is that those individuals demonstrated more accurate attention allocation, higher spatial education in terms of visual processing, and mental rotation abilities. From a motivational perspective, as we can understand, gamers are wizards in engagement. And so they really use interface and they use the graphics to really draw you in. And so what they use in terms of a motivational tool, I thought was interesting in that they use failure as a motivation tool. And so they have very limited or intermittent large scale successes. And so they bring that gamer to the game, knowing and understanding that they're going to have to overcome a lot of obstacles with very little success. And what they have found is that this intermittent reinforcement behaviors actually helps adolescents to persist in the face of adversity and failure. It's like if at first you don't succeed, try and try again. And so that research study actually showed and demonstrated that kids were actually developing agency and independent thinking because of the repeated reinforcements with intermittent behaviors that they were able to kind of train and do behavioral shaping based on the video games. From an emotional perspective, people use media often as a means of positive feelings and enhancing their emotional states. And so gaming is no different in that. And so the kids who were playing games, they had a more positive outlook about themselves. They felt more upbeat. Um, and several studies have shown the causal relationship between playing video games and improved mood and positive emotion for adolescents and teenagers. And then from a social perspective, we oftentimes think um, that individuals who play games are socially isolated, but we have the advent of gaming communities now. And so individuals are not only sitting in their rooms, but they're actually playing video games with individuals in intrastate, interstate, and actually in some cases internationally. And so what they have found is that kids and adolescents who engage in video gaming, they had more effective cooperative supportive skills. They demonstrated more helping behaviors. I think about my own nephews who are pretty adamant about teaching me how to play Roblox. And so they want to help me. They want to help their older uncle to kind of understand the gaming world and get me involved and engaged. And I can tell that they're very passionate about it and they want to help me. And so those are some of the things that I feel like effective cooperation, support, and those helping behaviors that can be advantageous to our adolescents and our teens.
Yeah, it's interesting. You can, Dr. Briggs, I don't know, you can actually get scholarships for esports now too. So it's more than just just kind of playing video games. Yeah,
Exactly.
There's an industry around it. So we just wanted to spend a couple of minutes also just giving resources that I found helpful and have provided to patients and families as well. So one of them is for Common Sense Media. I'm going to pull that up just so we can look at their site a little bit because we had mentioned them earlier. So this is a wonderful resource to just kind of go and to have if you're kind of asking questions or not sure about a type of media, and it breaks it down into what parents need to know about something, research, what books, movies, TV games. So Dr. Briggs had mentioned Roblox. So if we use that as an example and kind of look in, it'll tell you about it. It'll tell you the approved age for who should be playing for it. And it'll give you a brief rundown about what it is as well. There's also ways in here if you have parents need to go, or for parents, there's for educators, for advocates, to go through and just even create like a media timeline of your day. So to just give some structure, some idea of how much time are we actually using and spending on different resources in different ways, and what are we doing there, to give a parameter and kind of means or ways to go forward. So I like this resource a lot. Another great resource to just know about or to kind of have is the ACAP, which is the American Academy of Child and Adolescent Psychiatry, has a whole area or section that's called Facts for Families. So I did pull up one here. This is the other one that's specifically about. Well, I had the area highlighted, but they go through all of them here. But you can see media. Movies, media, and children is certainly effects for family. There's one specifically on video games as well, seeing as that's what we were just talking about, or violent behavior. And we'll just go through and give a brief rundown and kind of tips in what parents might find useful or what they can do. So I think these are two just reliable and good resources. If you are looking for more information or places to go, sometimes they're a good start. Dr. Briggs, did you have any others? Anything else?
No, I think that was it for me.
Okay. So we kind of rounded out. Are there any questions that we can help with or answer? Thank you for spending the time and listening to us today.
Yes.
Yeah, so if you all have any questions, now is the time. You can pull up either the chat or the Q&A to type those in, and that should be across the bottom of your screen.
Well, I will make some comments as people may or may not have questions. I thought the research on the gaming was particularly interesting for me because I would oftentimes warn my sister about the amount of screen time that my nephews were having. And I think that it is appropriate to have parameters. But some of the healthier benefits of gaming in terms of social emotional support, the helping behaviors, the development of agency, the persistency of challenges and overcoming those things. I think that I didn't really give a lot of credence to those things, and the research kind of brought that to the forefront. So I do not think that video gaming is not appropriate. But I do think that some of the games need to be more age appropriate. I thought that the research about the shooter games in terms of developing those spatial intelligence and things of that nature, while be it's important, I think that we also need to make sure that we are presenting this information to age appropriate individuals. And so I thought that that was very interesting from a research perspective.
Yeah, definitely. That was something that surprised me as well. It's very fascinating to learn about. We do have one question so far. Have you found any correlation between the 24/7 news and heightened anxiety in teens?
That is a wonderful question. So I don't have the research to back it off the top of my head, but yes. So absolutely, I think being exposed, especially depending on the detail that's given there and what they're kind of seeing, can absolutely play a role in what kids think about. I think the other thing that we aren't always cognizant of sometimes is our own responses to things. And I do think children and teens, even though they might act like they're too cool, look to us a lot of times for the examples and are smarter than we think that we are. So our own anxiety and reactions in response to the news also play a role. I think it's important to have the conversations or just have the time to ask them how they're doing, check in, make sure they're getting real and good information about things and that we're talking about things honestly with them. But absolutely, thank you for that question.
And I would even, because I do a lot of adults, I'm an adult provider. And so I'm seeing the same thing in terms of increasing anxiety for adult population as well. And so what I'm encouraging them to do is, as Casey mentioned, just making sure that individuals who have kids would take the time to really talk to them about what's going on in the media, but then also taking rest and taking social media breaks and taking breaks from the barrage of media that is oftentimes in our houses, in our homes. And so I see a lot of individuals who had post-traumatic stress, PTSD symptoms that have been exacerbated as of late because of some of the violence and some of the news that they're experiencing or consuming. And so I'm having people to take breaks from social media as well as some of the news cycles throughout the day, just as a means of taking care of themselves from a mental health perspective.
Yeah.
Thank you. We have another question. In relation to the benefits that video games can create socially, can these learned or enhanced behaviors transition over to face-to-face interactions?
Dr. Berson, you want to tackle that?
Sorry, I didn't know if you were going to do. So I think that no, you don't want to tackle
No,
it?
I want you to talk about it.
Okay.
That's definitely your wheelhouse. So,
Okay. It's interesting because they're still doing research on it. I went to a presentation at ACAP, actually their national uh, I guess meeting last year, and was showing that it could actually decrease anxiety. They were measuring almost biological like feedback components, things like heart rate and breathing, and learning to kind of work your way through and manage your anxiety when you're playing a video game made you not only a better video game player, you actually scored higher, but were able to manage your anxiety because they're kind of set up in this virtual world where the guy's waiting for you around the corner or these things are happening. So yeah, I think it can. I don't think it's always intuitive. I think those things always take practice, right? What we practice virtually or even in therapy sessions sometimes, we want the hope is that they're going to translate into real world.
Thank you. Have you all seen an increase in people reaching out for mental health care during COVID-19?
Yes. So Dr. Briggs and I actually had talked about this, I think, earlier in the year, just the effect of again school closures and virtual health and kind of what we can do and how we're helping. I think nationally, what I've heard just from friends and other people is just the amount of people seeking help has increased dramatically. I think that's good, right? That they know that the resources are there, but I do wonder the impact both of COVID-19, which is we're clearly learning more about, and what the long-term effects of that are going to be, and as well as isolation, um, and kind of not having some of those traditional support systems that we encourage, right? In terms of being out with friends, playing games or kind of being together. I think it also speaks to one of those benefits that we were trying to talk about earlier also with social media. It can help fill some of that social void, but it's certainly different. But yes, I've definitely seen an increase since COVID.
and I would say the same. And I talk about the pandemic from the perspective of COVID-19 and the shadow pandemic, which is the mental health piece. And I think that the mental health piece will stay around a lot longer than COVID-19 because, we'll have vaccines, we'll get back together. But I think that we will not understand as researchers and scientists the real impact of COVID-19 for years to come, because I think it'll be around for a long time. And so I I think we went 200% over what we were seeing in terms of numbers last year in our clinic, and we had to pivot to telehealth in a pretty expeditious manner. And so we were able to do that because of a great department chair, Dr. Lommel, was able to kind of make that happen. And so we have seen an increase and continue to see an increase in mental health related issues because of COVID-19. But I also think that individuals who were kind of on the fence about their mental health and sort of deprioritizing it for such a long time, because they were in isolation and because of the stress of becoming a parent, principal, teacher overnight, that those individuals who would normally sort of forgo their mental health to kind of keep the ball rolling were unable to do so with COVID-19. So that kind of forced their hand in a lot of ways um, to make make mental health their priority. Whereas in the past, they were able to kind of deprioritize that because of busy schedules and not having the capacity to really do a lot of those things. And COVID-19 really sort of put a grinding halt to our lives and made us focus on things that we wouldn't have normally focused on.
That is true. That's a good way to look at it. So shifting back focus to the video games, I think that fascinated a lot of people. This attendee says, thank you both for your insightful talk. Dr. Briggs, I also found the video games research very interesting. In addition to the positive effects found from playing the shooter video games, has research shown any increase in violent tendencies from playing such games?
I don't have any research in front of me, but I remember early on in terms of like, what was it? Grand Theft Auto and things of that nature. We heard a lot of negative responses about violence and kids actually mirroring a lot of the violence that they were experiencing or experiencing on the video games. And so I would say that, I think there's a correlation between, individuals who have been exposed to repeated violence over and over again and how that plays a part in their mental health. So I would say yes to that question as well, but I want Dr. Berson to kind of weigh in on that because she lives in this world and I'm more of an adult. When we were deciding to do this presentation, I was excited to find positive research on video games because we hear so much about the negative, but I want the expert in the room to kind of talk about how that translates and give us some responses there.
So I'm by no means an expert, but thank you for talking as such. But yeah, so I do think that there is this idea that increase to violence is going to have effects on children that we don't know about. So there have been some studies of children exposed to violent media that shows they can become numb to violence, imitate the violence, and show more aggressive behavior. And then younger children and those with emotional behavior or learning problems are more susceptible is, I think, where we are right now in our overall thinking. That being said, video games aren't all bad, I think is what we're trying to get across. It's more, are they age appropriate? How are we using them and how are we engaging? I also, there's like a whole panel. I don't know if you guys have kids or no, but Discord is another kind of social media. Well, not really social media. It's another site that a lot of gamers will use to talk and go through, and people think that they're anonymous and kind of going through. And so I think it's really easy to have that mob mentality and kind of joining on and going through, and it's really easy to get lost in the shuffle there too. I do think it's just important to pay attention to what games they're playing and how they're interacting with them and with people, right? Are they playing with people that they know? Are they, are these people that they know IRL, which is in real life, or are they just people that they've met randomly through the game? So those would be kind of where I would focus the questions about video games for kids too.
Thank you both. I think we have gotten through all of the questions. So thank you to everyone who joined us today. We have several more Spring into Health events coming up. If you're interested in more topics like this, you can visit uofscalumni.org/events for more of our event partnership with Prisma Health. But thank you again so much to both of you for presenting today. I know I learned a lot personally. I'm sure everyone did as well. And I just really appreciate your time.
Thank you so much for having us.
Yeah, thanks for listening and let us talk about media. It was nice to be here. Thank you.
Yep.
All right, everyone, have a great afternoon. Thank you.
Thank you. All right.